Alright guys, how's it going? We're here with Dr. Struck. Now I told you guys a few weeks ago I'm going to do a video with the doctor who performed my gynecomastia surgery. Now, for those of you who have seen the series, it was a 3 or 4 part series of my procedure done by Dr. Struck. And I've gotten a lot of good feedback, really good response from the videos. So I wanted to come and kind of dabble a little bit more into the gynecomastia procedure, give you guys more of an insight into what goes into that procedure, but from a doctor's point of view, because I can only give so much information, and really at the end of the day, I'm not a doctor, but he is. Can you go ahead and introduce yourself?
Sure. Hi, I'm Dr. Struck, Steve Struck. I'm a board-certified plastic surgeon here in Atherton, California, which is within a couple miles of Stanford. I've been in practice for about 17 years. I teach some at Stanford with the residents, but I'm mainly in private practice by myself. I think I've found these cases, these gynecomastia cases, to be kind of an interesting, within the last few years, evolving part of my practice. And I think there's clearly a lot of interest by the patients in this procedure, which we see from your case and from people that I've treated. I've done 3 people this week for this very procedure. So I would say, if having been in practice for 17 years, you're seeing a massive upturn in the number of people doing these. And I think it's, you know, increase in bodybuilding, increase in fitness. You would probably know better than I, but I know I see a lot more of them and do a lot more of them.
Now let's talk about, starting from the very beginning, what are the most common cases of gynecomastia you see? Now as a doctor, when you have a patient come in, is it bodybuilders, is it adipose tissue, so fat? What are the most common cases?
Well, I think for myself, I probably see more bodybuilders because I think I've gotten a little bit of a reputation for treating them. I'd say in gynecomastia cases, my percentage of bodybuilders is much higher. I think plastic surgeons on a whole, on average, would see more fatty gynecomastia. Okay. And that's probably the more commonly performed procedure nationwide. With that procedure, it's treated differently. We're usually doing liposuction. We're just removing fat. You take a lean guy like yourself and try and apply that procedure to you, you're not going to get anything. You're going to get no change, because if we did your case and went in with a liposuction cannula, that would not have come out through a liposuction cannula, so you would have seen nothing. So for me, I see a lot of the bodybuilder types, I guess, to answer your question directly, and I usually remove that tissue directly in the operating room and get very nice results with that. The fattier patients are treated differently, and they still get great results. You go in, but on them you're doing more lipo. You're taking out, you know, on you it was a piece maybe this big. On a lipo patient, I'll take out about the size of a small breast implant from them. So it's a different procedure. They're being lipoed. There aren't as many incisions and the results are different, but they're both excellent groups to treat.
Now, there's a common question that we get a lot, and it is it 2 different procedures to take out the breast tissue and to take out the gland? Now, this is something that I have seen way too many questions about, where people will ask me, well, what did you have taken out? Was it just the breast tissue, or was there a gland that he took out? Can you clarify what they might be talking about? Is that true or false, and what's going on there?
Well, for me, as I say, I've done a lot of them, and what I do is I go in there and I remove tissue, which is white in nature. It becomes very clear. I make my incision right under the nipple with the half moon, and when I lift that up, there is a little ball in there of white tissue, which is very descript, and I remove all of it. And it's usually breast tissue with some cystic tissue, and I think what it actually is doesn't really matter that much, but it's a ball of white tissue, and it's very clear where it is, and you remove that circularly. Then I go in with my finger, because I can usually get in there, and I feel. So for me, it's a hard mass that I can feel that I remove by palpation, and when I'm done, the firmness is completely removed. Surrounding it, you see normal breast tissue, normal fatty tissue, which I leave. If the removal creates a little sunken area under there, I'll usually feather with a little bit of liposuction just to get everything real smooth so we don't create a little crater underneath there. So maybe a fine amount of fine-tuning, but I believe it's just some glandular breast tissue, which is probably hypertrophied due to uses of various agents or other things. I don't know, anyone knows exactly which ones would cause it. That's usually what I see, and I remove it. And the mass is usually quite palpable and usually tender, and when I remove it, the pain is relieved and the mass is gone.
Okay, now to clarify, if you have this procedure where you take out the gland, because, and speaking specifically towards bodybuilders, there are certain agents and drugs that people will use to try to combat the gynecomastia without having to take the surgery. Now, is it possible from a doctor's point of view or perspective, if you were to have the gland taken out, to have the gynecomastia resurface or come back at some point, possibly due to agent use, drug use, or any other factor. Is that a possibility, or is it an end-all fix?
Oh, I think it could come back. I actually was just talking to a guy who said his got bigger and smaller. He was a competitor, and he said he had talked to people who had had it removed, and it still did come back because there are small remnants. You can't take everything because I'm looking at the muscle when I go in there. I take things down to the muscle. I see your pec muscle, and I've even shown it to guys while I'm doing it. You can see the muscle sitting there. So I go down to the muscle, but you can't just remove everything off the muscle, or you'll get a scar that sticks down to your muscle and it'll look artificial. It'll look like you had something done. So you want to leave a slight layer of gliding tissue under there so that you look natural. You don't want to look artificial or unnatural. And that tissue that you leave behind certainly could have a little bit of that glandular tissue in it. If someone didn't use stimulants that were stimulating it, it probably wouldn't come back. But if they were continuing to do whatever caused it, you would think it might come back, and you just treat that symptomatically again.
Okay. So to clarify, yes, it seems like if you are using drugs that may instigate the issue, then that issue would not be 100% resolved by just having it physically removed by a doctor. All right, so keep that in mind, guys. I know that's a very common misconception when it comes to bodybuilders. If I get it taken out, could it come back? And the answer seems to be, if you are taking drugs, there is a possibility it might. Now, what I've noticed in bodybuilding is that the side effects that you get from drug use, if you're using drugs, are really independent for each different person. It's very individual. So I feel like as a natural bodybuilder who had gynecomastia growing up and had to get it surgically removed, if I were to take drugs, I'd most likely be prone to having gynecomastia as a side effect. I've also had really bad acne, and I feel like that would be even worse or amplified if I were to take drugs. So there's types of people who I've noticed who can take drugs and have very little side effects. Keep that in mind. Now, what is your view overall on gynecomastia? Now, I did a video series and I spoke about how I felt you were a very honest doctor and that you weren't overcharging patients because of just the ability that you have the ability to overcharge patients. What's your view? Why do you feel like some doctors charge large amounts of money? What do you feel is a fair price for this procedure? And kind of go ahead and just dabble in that a little bit.
Well, part of that is based on the patient and what they can tolerate having done under straight, local, awake, what if they're a type that's kind of squirmish about needles and wants to be asleep in the operating room. Once you move to the operating room, you usually add about $1,500 to any fee because you're in the operating room. My opinion is that in the office, there isn't much expense, so the price should be made appropriate for that. The actual removal of the cyst, as you know, isn't particularly complicated if you have experience with it. It takes maybe an hour, maybe a little bit longer, because usually you're right on that muscle and you want to make sure nothing's bleeding. So you'd say an hour procedure. In the office, I feel $3,000 is a reasonable fee. In the OR, I think $4,000 is a reasonable fee. Those match what I think for an hour of surgical time. I do a lot of different surgery. That's about what I make for an hour of surgical time. So that's how I look at it. I think you see a big array of prices because within any field, there's kind of this one price fits all concept of my gynecomastia surgery is $8,000. Well, that might be for a large breast where you're doing lipo, where you're spending 2.5 or 3 hours in the operating room, lipoing, doing some lifting, doing a lot of procedures. It's clearly much different than the bodybuilder. So for me, I consider the bodybuilders to be a fairly easy, predictable group of patients. They're usually not very difficult to deal with. I make their incision, I take the tissue out, it takes me an hour or so. I like them to take it easy for a couple of days, and I feel that $3,000 in the office, $4,000 in the OR is a pretty fair price.
Fantastic. Now, on that note of talking about recovery time, that's probably another one of the most commonly asked questions I get. Nick, how long did you take off from the gym? All right, and I tell people what I did personally. I was about 2 to 3 weeks off from any movement at all because I had a hematoma that kind of really slowed things down on it was my right side actually. And so I started off maybe 3 to 4 weeks after with light work, and then moved into some light chest work about 2 weeks after that. So I started off with work that did not involve much movement at the shoulder joint, so I wasn't activating much pec. Now let's hear from a doctor's point of view. What's your take on how long you should be taking off from the gym if you're an avid bodybuilder?
I think those numbers are accurate. You have a good experience with it. I think, as I said, I'm right down on that muscle. So as we look at the immediate healing period, I think you do see a little more bleeding like you experienced. It's because you guys are strong. You've got a lot of circulation to that muscle. I'm right on the muscle. I'm creating a cavity about that big. So I think you might see bleeding in maybe, like you had in maybe 3 to 5% of the people. So I think if people really keep that compression on there for the first 2 days really tight and really take it easy for those first 2 days, you kind of get through that window of the risk of bleeding. Once you're through that window, if everything goes smoothly there and we don't have any hematoma or anything, which is 90%, 95% of the people, I think your 2-week number's fairly accurate. You know, I think at that point you're really not going to bleed afterwards. And you want to, so how do we go from 3 days to 2 weeks? 3 days to 2 weeks, I'd keep some real tight compression on there. I just had a guy send me a picture of himself in this neoprene strap thing. It was like an MMA thing that strapped around there real tight. You probably know what that was. And it was some brand through MMA. And it kept really good pressure on there. So I think if you keep pressure on for the next 2 weeks, then I think you're ready to go. You might be sore, your workouts might not be quite what you want them to be, but you would be able to speak to that. You'd be able to fight through it for 2 weeks to 4 weeks. And then you'd think at that time you'd be pretty much normal.
Right. Now, aesthetically speaking, when you're done with the procedure, and I touched on this in the series as well, literally the night I went home and I was unwrapping, there's an instant change. It was a fix that I was blown away by, because I grew up with gynecomastia. And so for those of you who followed me who also deal with it just through puberty, you understand how disheartening it is to have this issue that does not seem to go away on its own. Now, on the first night, I went home unwrapped and it looked flat, and that was amazing. Aesthetically speaking, how does the scar usually work? How long does that take to heal? And have you had any issues where there was abnormal scarring or any kind of puffiness from the procedure?
I think the scarring is usually very good because it's just a half moon incision right underneath there. With scarring, maximal phases of scarring, and it's different from patient to patient. 4 to 6 weeks is usually when a scar looks its worst. If you have a ropey or a thick scar at that time, some steroid injection, and our type of steroid injection into the scar will break the scar down and make it flatten faster. But I would say scarring is usually a fairly minor issue with these patients. The scar is usually quite good. Bodybuilders, they work hard on their body and they do have high levels of expectation, so that's part of this whole process. But I can't think, I have one scar that's kind of thick right now that I'd like to inject with some steroid, but that's about it. So if your scar gets thick and ropey, don't think there's nothing you can do. You can come in and get some steroid injection, some scar massage. Usually, I don't know what your experience was, but usually at 6 months, the scar's pretty well where it's going to be.
And does scarring vary by body type and or ethnicity, or do you notice it's flat across the board?
Well, I think any darker skin group is going to produce, in general, a darker scar. Filipinos can produce ropey scars on you at times. African Americans produce ropey scars. The nice thing is, though, it's not like a scar right in the middle of your arm. It's a scar at an area where there's a pigmentary change anyway. So if you go through a phase of scar color change, it's usually hidden by the areola. The times that I inject are if the scar is elevated, because an elevated scar you can slightly see. So an injection will flatten that scar out. I don't think the scar is really a big issue, and I think in patients where it is an issue, it's kind of a minor big issue. It's not a huge big issue. It's a manageable issue. It's an inconvenience. I mean, if you pick someone, also you can look at the scars elsewhere on their body. If you have an African American bodybuilder come in with a keloid scar on their arm, you know that they're more prone to do that. And you might say, hey, maybe for you, since you're a keloid scar former. So you can ask yourself, do I have scars elsewhere on my body? If they're ugly scars, then you can kind of think my scar might not be as great.
Okay.
So that's kind of something people can use to judge themselves also.
Now, if you had to give advice to the adolescent group, the teenagers, what would it be? Now, again, most people who are developing this through puberty the way I did, they want it fixed. And now I want you guys to understand and remember that I got it when I was 15 and 16, and I had it removed when I was 24 and 25. So I waited until I was in my mid-20s to have it taken care of. Now, what do you suggest? Because I get asked that a lot. How long should you wait if you have it due to puberty? What's the time frame you're looking at until you really need to say, I need to go to a doctor and get this taken care of?
Well, during puberty, I think it gets into a different ballgame. You have a lot of moms that bring their sons in during puberty, or their sons just come in. And they should see a pediatrician first to have it worked up. There are some medical causes that should be ruled out. In the vast majority of cases, you send them to the pediatrician and it comes back and they say there is no medical cause, and then you go on to the next level. But in that group, unlike adults, it's important to have it worked up by a pediatrician, and they just do all these different hormonal assessments and all these things. And then that's usually an insurance type thing, and then they send me a report that says there is no medical cause to this, and then you decide based on the extent of what they have, how much of it's fatty. If it's fatty, it's more fatty in the younger kids usually. So usually in them, you can either wait for it to resolve until they're like your age, or if it's significant and they've been cleared, then you could lipo it a bit. I don't think you see as many of the hard little lumps in the younger ones as you do.
Have you known or seen cases that have developed due to being overweight, because that is very prevalent, people who are overweight who have more of the man boobs, the fattier breasts? Have you ever noticed that to take care of itself naturally, or do you feel like you would suggest for those people who have an issue with it to get it removed? And I ask this because a lot of us who go through having gynecomastia, we sit with our fingers crossed hoping that it's going to resolve itself. And now it did not until I came to you and you removed it. Now for people who have it, and I say mostly because from the adipose tissue, because mostly that's the most prevalent, where it's just, it's noticeable, they notice it, and they kind of linger hoping maybe it'll go away. What's your suggestion to that group of people?
Well, I think if someone's fit and they're, in general, they don't have to be perfectly fit like a bodybuilder. If they're pretty fit and they have, as you said, man boobs, that group might be more in the lipo group. You might just go and lipo them. If someone's overweight, they're probably better off trying to control their weight, because I think they're going to get a better result. They may not completely get rid of it, but in my opinion, if a real overweight person comes in and you lipo them, they're not going to see enough change, and they're going to be somewhat dissatisfied with the procedure. They'll think the procedure failed when really it's just they had too much fat to get successfully done. So heavy patients, overweight, noticeably overweight patients, probably better off trying to lose some weight on their own. Fit guy, 50-year-old guy who's in decent condition, who feels like they have man boobs that embarrass them on the beach or something like that, that guy, I'd probably just lipo them. It makes sense. They've tried to take care of themselves and they can't get rid of it, and you lipo them.
Okay, so on that same note, now I had mine from puberty. It was not large in respect to how bad some of the cases get. Something like that, would that tissue, in your professional opinion, ever go away on its own?
That one I don't know the answer to. Yeah, I'm not sure on that. It could, but if it had been there that long, it probably wouldn't. You'd think it wouldn't. I mean, intuitively speaking, if something's been present for 7 years and you've done everything you can do to take care of it, it's probably not going to go away.
Okay, and thank you for answering that honestly, because I think, again, people wait idly hoping that it's going to resolve itself, and I wanted to get a professional opinion on whether or not you're going to be waiting in vain, or whether or not you really need to just take action and have the problem resolved by going to a doctor. All right. Can you think of any other suggestions you'd like to give to anybody who has gynecomastia?
I think along the lines of what you said, what you just said just recently, if it's fat, it'll probably go away if they lose weight. But if they're not heavy, then it's probably not going to go away, because it's probably a structural thing. No, but I think this group of people has been a really rewarding group for me. It's been fun. It's been fun dealing with you, and the patients are happy. I think it's cool with the bodybuilder guys, especially, that you're taking some out this big, but they really feel happy about it. I mean, they do. Like you said, I had one last night, and he's like, I looked at him, I can't believe, right when I took his out, he had his hands like this, and he just looked down, and he just said, I can't believe how good that looks. So as a doctor, it's fun to see someone that pumped up about something that took an hour.
Right, absolutely.
That's a good thing.
Before we take off, let's just go ahead and kind of recap what the procedure would look like if somebody were to come into you and say, Dr. Struck, I need to get gynecomastia surgery. Would you schedule them? How many follow-ups would you have with them physically? And I ask this because people who might travel out of the state or out of the city, and they come to you, or just in general go to a doctor, what can they expect in terms of how many follow-up appointments and whatnot? How does that look?
So yeah, the surgical procedure, like I said, hour. I usually see you the next day to make sure there's no bleeding or significant swelling in there. There will certainly be some swelling. I normally don't use dissolving stitches. I like to take those out. I leave those in a little bit longer because I've had a couple of them open up on me due to swelling and activity. So I might leave those in for 10 days. So maybe 10 days you have your stitches taken out. I have a guy coming from quite a ways away. I'll put some dissolving stitches in him and some super small skin stitches that he'll be able to remove himself. So 10 days you're having your stitches taken out. Often at a month, you'll see people to check. But if the scar is healing well, many people, it'll only be those 3 visits. If someone goes into that ropey hypertrophic scar, if you want to look up hypertrophic scar, that's the technical name for it. Someone develops a hypertrophic scar, they might get a steroid injection once every month, 3 or 4 times. Okay. So that would be an outlier group where their scar is kind of acting up. But in general, I think it's like 3 visits.
Okay. Yeah. Okay. So pretty quick, pretty painless, pretty easy. Yeah. And that was my experience as well too. If you're able to get over the fact that yes, you're going to be awake under local anesthesia for the procedure, then I would suggest that route if you're a bodybuilder who's looking to get the gynecomastia taken out. And of course, getting a doctor's recommendation on what to do is key, but I stress that you guys really do your best to find a doctor who works very honestly, and that's why I came to Dr. Struck. He's a very honest man, and he does not feel the need to overcharge for something that might not be worth that. He values his time, and he values your time, and he finds a nice place in the middle, and he works with you on that. So again, I suggest that if you guys are out of state and you're looking for a doctor and you're not going to be able to travel to a doctor specifically, do your best to talk to multiple doctors and kind of get a feel for how they are as a business person, because that's going to really help you understand the kind of work they're going to put into your body. I was more than pleased with what Dr. Struck did with me, and I really appreciate him taking the time to do this video. So please leave your comments, like it, share it, and hopefully we'll get some good feedback from you guys. Thank you so much,
All right,
Dr.
thanks
Struck.
a lot, Nick.
Appreciate it.
It's fun. Thank you.